My name is Jody Stabinsky. I'm a pediatric nurse practitioner for pediatric pulmonology at Penn State Children's Hospital in Hershey, PA. I have been in this role for 18 years. Today I'm going to discuss diagnosing respiratory syncytial virus in the presentation of looking at COVID-19 and other viruses. Typically they may present the same. We will treat them similarly, and the way to make the definite diagnosis is by a respiratory viral panel to confirm the diagnosis. So when looking at the presentation of any age child, they will usually have fevers, cough, sometimes a wheeze, sometimes not. Looks like they have a lot of nasal secretions and increased distress depending on how severe the symptoms are. They all three can, again, have fever, and you can have dehydration, which can be a secondary issue. COVID depends on the strain and how it presents. We've seen a variety of strains of coronavirus 19 or COVID-19 that has not had any symptoms in the pediatric population up to significant symptoms requiring possible oxygen supplementation, some airway clearance, and supportive care. Typically, again, low-grade fever, they have aches and pains, general malaise, sore throat, and sometimes even nausea and vomiting. Usually you'll hear of sick contacts, and there'll be positive COVID-19 around them. When you look at a child that is coming in that possibly has some colds, this is again a wet or dry cough, congestion, especially in the nasal area, rhinorrhea, sometimes fussiness, low energy, fever. RSV, when it's more than just a cold, usually looks like a child that has, again, coughing, increased respiratory distress, possibly even a pneumonia by x-ray. Bronchiolitis, you'll see inflammation. RSV bronchiolitis, again, can look like the flu. It can look like COVID. They have massive amounts of nasal congestion to the point of sometimes obstruction, and that makes it difficult for some of these infants to eat. And so they can be dehydrated, tachycardia, tachypnea, and dyspnea. You may hear wheezing. Again, you'll have a high fever. And these all will last about a week or even 2 weeks. Antibiotics in any of these conditions are really not helpful because this is viral or flu, influenza. And we typically don't use any type of antibiotics, but we use supportive care. You can get a secondary pneumonia and infection that may be bacterial later, but first off, you do not usually use any type of antibiotics. Treatment, again, in all three conditions is usually aimed at the symptoms. So you want to make sure they're staying hydrated. You want to make sure if there is a young baby that they're keeping their nares clear, and that may be helpful with saline and bulb suction. The other thing is, if they are in any type of distress at any age, you may need to put them on a little supplemental oxygen. And again, they may need to be hospitalized depending on the degree of respiratory distress. Good patient information and parent education is very important, especially with RSV and COVID. They can live on surfaces for a while. So we want to talk about trying to isolate them a little bit, hand washing, making sure that they cover their nose and their mouth when they're coughing or sneezing, they're school age, and making sure that they are resting. All children, usually at one point at a time, will get RSV, but again, the symptoms run the gamut. I hope this helps you in order to decipher some of the presentation that looks similar. And again, having to get a viral panel may in fact confirm the diagnosis, or COVID testing can confirm the diagnosis. I thank you very much.